one way to think about a lot of the features of autism is that they represent a spectrum of neural diversity in which social interaction and the awareness of change and sensitivity to change in routines and things is different than the average person. One of the problems now is with this term Autism Spectrum Disorder, which has many benefits, but it also, one of its negatives is that it includes people who are so severe they'll never talk, and they might even have difficulty walking or even with basic activities, even going to the bathroom, to people who are extraordinarily brilliant, who have many talents, and yet have some social difficulties, or are just different. They just view the world differently, and so those are very, very distinct conditions that really one doesn't require treatment per se, in the typical way, and the other requires likely medicine or some kind of substantial therapeutics. I would say the next frontier is really cracking the mechanism of several of these rare, severe forms of autism and being able to get medicines into the clinic to actually ameliorate symptoms and or reverse some of the symptoms. So we're modeling these in animal models, and in a dish, making these human three-dimensional little mini brains. We can put the mutations in that cause autism, and then we can observe them and understand how these mutations might cause autism. And that will lead to therapeutics, is the hope, ways of figuring out how to reverse what's happened. I want to make it clear that our job is not to eradicate autism or to change people that have it in any way. It's really to eradicate the parts of autism that reduce the quality of people's lives. I think there are a lot of dimensions of awareness that are very important, that have nothing to do with the current research, but that can make the world a better place. It starts a conversation about how, what is autism, for those that don't know, how it impacts families, and how it in fact impacts the children and adults that are diagnosed with autism. And of course, it also helps us with research in that it makes people more aware of the burden that autism can have on families and patients, and further on society, and that our job is to help alleviate that burden and to improve the lives of people and families with autism.